My name is Stacy LeBaron, and I am the founder, host, and head cat at the Community Cats podcast. I have 30 years experience involved with reducing cat overpopulation, especially in Massachusetts and New England. Many of the tools I'm sharing with you today, I learned from 1996 to 2012 when I was the president and executive director of the Merrimack River Feline Rescue Society. One turning point for me was the creation of the Catmobile program. I currently serve on several nonprofit boards, as well as I'm the co-owner of two feline-only clinics in Georgia here in the United States. I consider myself a feline entrepreneur and a cat connector. I would like to thank the International Companion Animal Coalition for hosting this event. Here at the Community Cats podcast, we have a weekly podcast. We have over 30 online educational programs, monthly blogs, and a lot of information. At the podcast, we believe in turning your passion for cats into action. So if something is missing to help you to be more successful, just let us know. We'll work with you to help solve your greatest challenges. So what are the greatest cat-related challenges that I have seen over the last 30 years? Cat overpopulation is certainly one of them. Funding is usually another. In 1992, when the Merrimack River Feline Rescue Society started, they were focused as a TNR-only organization with 300 cats on the Newburyport waterfront. But due to the kittens and abandoned cats, they quickly moved to rescue. 125 cats and kittens were removed from the waterfront in that first year of operation. We continued to maintain 14 feeding stations in this area. And by 2008, the last cat had passed away and the stations were closed. As word got out about the work that we were doing, everyone else wanted one of our programs in their own town. By the end of the 1990s, we knew that running an adoption program was very expensive to do, as well as the veterinary care of community cats. So in 2000, we started monthly free spay-neuter clinics for feral cats. Any cat in a trap was welcome at these events, and it was volunteer run, and the supplies were funded by donation cans. Cost per cat at that time was $15 versus the 100 plus that it would cost at private practice for spay-neuter. You also couldn't do volunteer spay-neuter in private practice either. We also were encouraging people who had colonies of cats to trap, neuter, and return the whole group at one time. So we had already started doing some targeted spay-neuter to be able to utilize this free surgery service to do large groups of cats. And that we really saw as a way of being impactful in the area. To do a clinic of 20 cats from one location was really a great feeling because we knew that we had most of those cats spayed and neutered. And so the number of kittens that would be born would be way down. But these clinics were only for cats that were being returned. They weren't for owned cats, and they weren't for cats that were going to go into a rescue pathway. The intakes weren't going down as we anticipated they were as a result of these TNR clinics. So intakes in the local shelters, those numbers, we were checking in with the organizations and our own numbers were not going down like we thought they would. We were missing something. We didn't know what it was at the time, but we were missing something. So my aha moment came when I went to rescue 30 kittens living in a dumpster behind a bar. They were sick, they needed help, etc. When I looked into the woods, I saw 3 apartment buildings and several adult cats in the woods. And there it was. The cats had come from the apartment buildings. How could we get to the source? That was the day that I totally realized we needed to go and get those owned cats spayed and neutered. We would not be making a difference in the lives of cats if we didn't do that. So providing owned cat spay neuter in that community was critical to success, and in any community is critical to success. So we developed a Catmobile program at the Merrimack River Feline Rescue Society, and we launched it in 2008. Since that time, the Catmobile program, which is a mobile veterinary spay-neuter clinic, has spayed or neutered over 77,000 cats. Since 1992, we've adopted out 25,000 cats. And then the TNR clinics have spayed or neutered 15,000 cats since they were started in 2000. So perspective, the newer program has assisted more cats. It's much a higher volume program. The Catmobile operates budget neutral, where our adoption program needs significant funds to support it. As I started the Community Cats podcast, I wanted to be able to take things that I learned while working with the Merrimack River Feline Rescue Society and be able to share this information with others. And that's how I got to the creation of the Community Cat Pyramid. The Community Cat Pyramid is sort of based and modeled after the food pyramid. It is a way for the organizations to be able to see if their objective at reducing cat overpopulation is being met within the community. It's a strategy that might then make you shift how you are operating your programs. There are many organizations that feel overwhelmed, and they tend to operate reactively to emergency situations. At the MRFRS, originally, we were focusing our efforts on rescuing cats and adopting them out and doing a bit of TNR. Every summer, we were just inundated with cats and kittens from the same areas we had helped the year before. We needed to change our focus onto the owned cats in a big way. I knew to be impactful, we would have to offer services to a large population of owned cats. You can build a program like the Catmobile. You can collaborate with a veterinary practice and give them some parameters and just pay the bills. I've also done that model too. So there are a variety of different ways to be able to reach the owned cats in the community, be able to offer affordable, accessible spay-neuter services. But we chose to go with the Catmobile at the Merrimack River Feline Rescue Society. The pyramid is a visual model of how critically important it is to have these components in your community. This doesn't need to fall all on your shoulders. This is a representation of a whole community. So this pyramid could be filled with inputs from a variety of different groups within your community. It doesn't have to be all of the programs within your own organization, or it could be your whole organization, depending on your size and your scale. Many folks find this Community Cat Pyramid very helpful to share with others that are interested in reducing cat overpopulation in their towns. Another tool that we were able to create is the Community Cat Calculator. This sort of takes things to the next level. It's really a goal-setting tool for organizations to try and strive for reducing cat overpopulation in their community. This is not a population calculator for like the in total number of cats that are out there in the community. It is an annual calculator for the number of surgeries that you need to reach within a 12-month period of time. This calculator is focused on our zip codes in the United States, but we do have a methodology chart where you can just plug in numbers and do the math for your own area, your own population numbers, and you'll be able to do these calculations manually on your own without any problems. We have a QR code here right on the screen, and you can just scan it and check it out. And we are happy to assist with it. It is a goal-setting tool. This is not a population estimation tool. And so just keep that in mind. And you're going to notice, as in this example here, that the owned cat spay neuter is significantly higher than what the TNR numbers are. So it's goal setting, it's information gathering. It is not an estimate of the actual number of outdoor cats that are outside. So before I leave you today, and I certainly want to thank you for spending time with me, I wanted to share a couple of two takeaways. One's easy, one maybe not so easy, but there's two takeaways here. And so I just wanted to share them with others, with you all. So we have this paper collar, and this is something that culturally changed about 20 years ago in Massachusetts, which was before anyone within the community brought in a friendly cat into a rescue organization or a shelter organization to put up for adoption. We required that they wear a paper collar for 2 weeks so that the outdoor cat has a chance of being reunited with their owner, and they realize that there's another community member that's concerned about the well-being of the cat. So if it's a friendly cat and it seems to be in good shape, and you are concerned about a friendly cat, or members of your community are concerned about friendly cats, we ask that a paper collar be put on that cat. Now that collar may get wet, it may get broken, it may get ripped off, but you can always reapply the paper collar. This is very important because many people feed community cats, but they don't claim specific ownership by either microchipping or putting collars on those cats, or having the cat ear tipped. So it is really critically important to ensure that you're not removing a cat that is potentially already taken care of in the community. There was a study done in Virginia on this topic, and the end result was about 80% of the cats had someone taking care of them, and they did not need to come into a rescue or a shelter pathway, which resulted in an immediate reduction of about 10% of their intakes during the summer months. So that was really excellent and very much of a pleasant surprise, I would say, to that shelter. So please do consider always having a paper collar as part of your community cat toolkit that you have out there. And then, lastly, keep in the back of your mind that spay neuter capacity creation is you don't have to be a veterinarian to do this. I was very actively involved in getting the Sunday spay neuter clinics developed for the Merrimack River Feline Rescue Society. And the folks that headed up that effort were not all veterinarians. We certainly have brought veterinarians in to be part of the program, but the leadership of that effort were a group of non-veterinarians. So you can create and build capacity in your community for additional spay neuter. I do know we have a veterinary shortage out there, and we have spay neuter capacity shortages. Some people refer to them as spay neuter deserts. And I just want to bring that forward that you can be part of building up more spay neuter capacity in your area. Also was very intimately involved in getting the Catmobile program started at the Merrimack River Feline Rescue Society, and have been very closely involved in developing the community cat clinic, which has 2 practices in Georgia here in the United States. So I've been involved in pretty much as many models as you can think of with regards to spay neuter, and I am not a veterinarian. I am very much more in the administrative side of ththings. If you're interested in next level learning, please feel free to check out our Community Cats Program Management course that's offered at the University of the Pacific, Bernard College. It's an 8-week course. We take the learning to a higher level. This is for folks that are interested in leading organizations, growing organizations, play a role in large municipal efforts or large humane societies, or at the animal control level. We have had veterinarians take this course, municipal leaders, pretty much you name it. We have had everybody in the class, and we orient the class to the needs of the students too. So we have a live Q&A session every week, and we're willing to help you be able to help the cats in your community. So if you are interested in going to that next level, it would be great to see you. I co-lead this course with Elizabeth Finch, who is at the Community Cats podcast with us also. Here's a QR code with a page of hints and helpful tools. So please feel free to go and check that out. We'll also have a link in there for a paper that John Boone and I co-wrote called Free Roaming Cat Management, a Funder's Guide to Better Impact. So if you are at an organization that does some funding for community cat programs, there might be some interesting information in that paper that we released a couple of months ago. And it's, thinking systems-oriented thinking, going upstream and trying to get to the source. I always talk about Adam and Eve and how we want to get to Adam and Eve and ensure that they are spayed and neutered as young and as early as possible. So at this point in time, I would just like to thank our hosts again for putting on this wonderful conference. And I have my contact information here, and I am happy to open the floor up for questions at this point in time.